We are live now.
Akil, unmute yourself. Akil, unmute yourself.
So, good evening and a warm welcome to Expo Talk series. My name is Akil Rashid and I'm the Research and Knowledge Hub Chief at JKPI. I'll start today's session and introduce the speaker. Jammu and Kashmir Policy Institute has initiated the Expo Talk series to engage experts, change makers, pioneers from various walks of life to understand the dynamic context of implementing the UN Sustainable Development Goals on its agenda. The vision and intention of the Expo Talk series is to source inputs and recommendations from experts in various fields pertaining to different sustainable development goals through one-on-one dialogues. The 1 hour long interactive session will consist of one-to-one dialogues between the moderator and experts to dig deeper into various topics and probe their various dimensions with a dedicated Q&A. The entire session is being broadcasted live on the official page of JKPI. Tonight, we are delighted to be joined by Hina Fukuruddin, who is a psychotherapist and mental health professional working with the intersections of trauma, relationships, community building, and social justice. Since 2009, she has trained and worked in academia, research, clinical, and field settings throughout her mental health career to facilitate change and growth within individuals, families, and communities. Hina will discuss the topic managing trauma and PTSD in COVID-19. On behalf of the entire team of JKPI, I welcome Hina. Thank you very much for taking the time to be with us. Without further ado, I would like to pass on the mantle to Tanveer. He will facilitate the session. Thank you.
Thank you, Akil. Thank you so much for giving a warm introduction of our guest. Okay, so as we all know that today we are talking about managing trauma and PTSD in COVID-19. So as we all know, PTSD, post-traumatic stress disorder. So as we all know, COVID-19 has become a global health emergency, resulting in not only physical health concerns, but also psychological concerns, as people are exposed to unexpected deaths or even fear of death. For example, healthcare workers who have close contact with COVID-19 patients are not only exposed to the virus on a regular basis, but they may also be witnessing increased illness, deaths, and even supply shortage. So in addition, patients admitted to the hospital with COVID-19 experience social isolation, physical discomfort, and fear for survival. These exposures increase the risk of developing PTSD. So in addition, the risk may be further enhanced during the subsequent weeks when these individuals may lack immediate social support due to the need of self-quarantine. So now talking of PTSD, as we all know, PTSD is a psychological condition that occurs on the heels of a traumatic event, ranging from a natural disaster to the death of a near one, or even to a global pandemic. So PTSD can happen to anyone, regardless of their age, ethnicity, and gender. It's normal to have a fear response to something traumatic. Typically, that fear response diminishes over time. The intensity of the memory fades and we move on with our lives. But in PTSD, the memories do not fade. They feel very present and can intensify over time, and they can influence our thoughts, emotions, and our ability to function. In some cases, PTSD symptoms persist for months, and sometimes it takes years. They do persist for years. And PTSD may coexist with other psychological problems such as depression, anxiety, and even substance abuse. Substance abuse, we all know that it's excessive use of psychoactive drugs such as alcohol, pain medications, or even illegal drugs. So it can lead to physical, social, or emotional harm as well. So without further ado, let's move to the Q&A session. So my first question to you, Hina, have there been any change in the cases related to PTSD during the COVID-19? Any observations that you found to be unconventional? Thank you.
Thank you, Tanveer. And thank you, Akil, also for the warm welcome. Getting right into it, as a trauma-informed therapist, I feel many of us have experienced some sort of trauma at some point in our lives, right? We've all had difficult experiences. At some point or the other, there are things that we find difficult that others may not, but it doesn't mean that it doesn't cause us pain or doesn't cause us harm. And what I'm seeing, or what I've seen and I've heard from other colleagues also in the field, is that, there is many people who may have been struggling with PTSD before are experiencing like heightened, difficulties because of their PTSD also being triggered by the pandemic and the lockdowns and, the related consequences of these events. And in that way, I think so a lot of people who have experienced PTSD before are sort of re-experiencing it in different ways, as in due to what's happening right now in the country and across the world, actually. Along with that, a lot of people who may not have processed, previous incidences in their life or previous feelings or emotions about difficult experiences are also then now forced to kind of, pay attention to it. So which is why we have seen a very large rise in, demand for mental health services since the start of lockdown in India last year. A lot of people have come forward seeking therapy and other, mental health care services, mainly to sort of start. Many people will say, or many people I've spoken to have said, I always wanted to start therapy, but now I have to start. And it's so they feel like it's come to a point where there is no other solution except to start therapy because they can no longer ignore what is happening. So in that way, I think the COVID-19 experience has then sort of, in one way, it's encouraged a lot of people to come, forward and sort of seek mental health care, to kind of, face the stigma even then. But on the other hand, it's also created a lot of havoc, I think, for a lot of people. In terms of unconventional, I think the thing that was unconventional was this, that the demand in mental health care services was not something I was expecting. And I think many of my colleagues in the field would say this, like last year in February, if you had told us that because of COVID-19 pandemic and its impact, we're going to see so many people actively seeking out care, I think many of us would have been very surprised. So that's been the most unconventional part of this all so far.
Thank you so much. Okay, so next question. What have been the specific contributing factors to trauma and PTSD during the COVID-19?
Well, like I said earlier, right? So many people who have had PTSD before have experienced more distress, especially if they're feeling like they're impacted by what's been happening and the PTSD is being triggered. So many people have reported like higher distress from that. Many people have had to face difficulties beyond, just economic and social spheres, right? A lot of people have had to deal with job loss, unemployment, loss of safe spaces at work, in college, in university, for those who were in educational settings. For many people, death and the news of death and loss has also amplified a lot of grief. Perhaps grief that already existed, but also just in terms of, for example, many of the community practices in India around death and mourning are collective practices. You do it as a community, you do it as a group. So the thing is, many of us have not been able to take part in these kind of things because of the nature of the pandemic. Yeah, for good reason, there's been restrictions in place, but it means that then communities and collectives, like groups, we've lost, these opportunities to come together as a community, to come together to, pay homage to the lives that have been lost, to the memories of the people that we lost to this pandemic. So very often that in itself has, added to the grief, I think, for many people. Again, like I said earlier, right, a lot of people may not have processed what has already happened in their lives, or difficult experiences or difficult emotions. They may not have been able to process that earlier. And now for example, many people have had to confront these things, but they've also had to confront them in ways where, maybe they're not able to access mental health care. They're not able to perhaps find a therapist in their town or their city. In small towns and cities in India, this is very true. Like there's a very, dire shortage of mental health professionals. So very often, you can't access mental health care. Like therapy is hard to access in smaller towns and smaller cities. Other than this, it's, the things that have happened because of the pandemic, right? Physical isolation from loved ones. So many people stranded in different places, far away from family, from, support systems. Sometimes not being able to access, like being safe perhaps, but not having, not being able to access your support systems. Very often discrimination, prejudice, these things have also created barriers for people trying to access support. So the thing is, if you look at any one of these factors, it has such a significant impact for, generally anyone. Like it could impact anybody in a very serious way. So then all of these things put together, there's so many multiple factors that are, leading to or contributing to, feelings of trauma, contributing to rise in PTSD during this pandemic. So it's not just even one factor. It's like there's so many factors, and anybody could be having multiple factors as well. So
very brilliantly answered. Okay, so moving to a very important question. How do age and gender play a role in the trauma and PTSD? And how youth as a group is affected by trauma and PTSD?
So generally speaking, right, the science, what we've seen in research over the years, especially in the last 20, 30 years, what we have seen is that very often women have a 2 to 3 times higher risk of developing PTSD. And this is mainly due to the fact that they are more exposed to, what is called high trauma events, that there is a likelihood of more high trauma events happening with women, especially, for example, sexual violence, gender-based violence. So for those reasons, women are considered to be at 2-3 times higher risk. But this is also, it's not just about gender though. It's also, for example, alternate sexualities or minorities. So everybody, there are a lot of intersectional aspects, different parts, different kinds of identities that actually are at risk for PTSD. So very often, so it's not to say that men don't face trauma, men face trauma. And then the worry with men facing trauma happens to be that very often they're not able to access help because, socially perhaps it's not acceptable for men to kind of step forward and say, oh, I need mental health care or I need mental health help because I'm having trouble. So there are these social factors also at play with this. In terms of age, there's a study this study is actually from the last 10 years, in fact, which is showing that, a lot of youth, when faced with trauma and PTSD, especially if it's on a, it's an unending cycle of trauma, then very often what you're going to see is you're going to see anger, you're going to see disappointment, hopelessness, lots of stress, mental illness, suicide risks are very high for young people due to trauma and PTSD, especially in ongoing, if it's been going on for decades or even years, So right now, we are already in year 2 of the pandemic. And, you can see how people are kind of struggling to sort of get through this year after having already gone through a very, tough year in 2020 with the pandemic and the impact it's had. So there's a lot of these kind of situations. And if you remember, I'd already said, right, many of us have already had difficult experiences. So everything, there's residual trauma from those things as well. Then all of this is getting combined. And like you already said, Tanvir, like you mentioned earlier, substance use. Substance use and abuse is also very high among youth that's impacted by trauma. So very often these, disappointment, anger, hopelessness, stress, mental illness, suicide, drug addiction, as we, then generally we tend to say locally, like, drug addiction, all of these things are most commonly higher, they're higher risk. Youth are at higher risk for these issues when trauma and PTSD are not addressed. And that's mainly because the points about, if you don't feel like you have a future, when you're young, and if you can't see a future ahead of you, then, you will try to find other ways to sort of alleviate that feeling, right? And so that's how oftentimes, that is how these other issues are then going to come up. It's very stressful if you can't see a future in front of you. It's very hopeless. So, so when youth are feeling that way, then it's no surprise that you see trauma and PTSD rates so high in that group.
Thank you for the gentle answer. Okay, so moving to India, India being a very large country in terms of population, in terms of area. So do we possess the required expertise and infrastructure to address the growing cases? And are there any barriers?
Short answer is no. Such bolo. No, the thing is, I think we should focus on improving manpower and infrastructure for the country. But the fact of the matter is that we don't have enough personnel. We don't have enough people to address the not just the number, but also the various types of mental health care difficulties that we're seeing in this country. We actually don't have enough people. So, for example, based on our population, the ideal ratio is that you should have one psychiatrist for 8,000 people. Okay. By that calculation, if it is one psychiatrist for 8,000 people, technically we should have 13,000 psychiatrists in the country. The current number, and this is a number from 2018, okay, just to be honest, like it is a number from 2018. The current number, I think, is somewhere like 6,000. We have 6,000 psychiatrists registered in the country. And that's like about half the number of 13,000, right? A lot of the people also, like I said earlier, small towns and cities, a lot of small towns and cities don't have psychiatrists also. Yeah. So then you can imagine what rural mental health care, what are the difficulties there then? For people who live in rural areas and semi-rural areas, accessing mental health care then is extremely, extremely impossible. So, this number itself, right? The fact that you don't have these many psychiatrists, but not just psychiatrists, okay? Psychiatrists is one kind of mental health care professional. Now, for example, you look at clinical psychologists. So for the same number, right, it should be 20,000. We should have 20,000 clinical psychologists in the country. But at the moment, I think the number is somewhere close to 7, maybe 5,000 or 6,000. Yeah. So the thing is, if you look at population-based numbers, we should have a lot more professionals. But unfortunately, right now, what's happening is that we don't have enough manpower. Same thing with psychiatric social workers. Technically, you should have 35,000. Yeah. But I think the numbers for that is also like somewhere, if I remember, I might be wrong, but it's somewhere in the 4,000 figure. Yeah. So you don't have, so the thing is, you don't have, and psychiatric nurses also, you need 30,000. But the number for that is also like maybe 2,500, if I'm not mistaken. So the point with this is that there's a very large demand for mental health professionals. We need manpower, but we also don't have enough, right? We don't have enough people to sort of, so the idea isn't that this many people are unwell, but you have to have manpower who is ready to answer the call when needed, yeah? And that is something that we're missing. So that's just manpower. So that is, we're just talking about people, mental health care workers like myself, who are available to address issues. On the other hand, if you think about why there is so few people in the field, part of that is also because it's not economically viable to make a living in the field for many people. Yeah, not many people can afford to take a job in mental health care, which means, so what I'm talking about is training, right? And then specialization for people who are going in those particular specializations. These things also are a concern for people who want to train in the field. But also in terms of what is the budget allocation? Yeah, when the total healthcare budget, if 0.001% is reserved for mental health, then infrastructure is also impacted. The other part about this is addressing infrastructure can also be not just about creating mental hospitals, but you can create community systems. You know, you can create community mental health programs where it stays within, you know, the communities, and the communities involved in running them. But this also needs, you know, for example, training. It needs infrastructure. It needs a lot of resources, perhaps, from the community. So communities also have to be able to take it up, but that still needs, you know, budgeting and allocation. And then, you know, the other part about this is our view of mental health. If you have a biomedical view of mental health, then generally you're going to say कि अगर मानसिक बीमारी है तो आप हॉस्पिटल जाइए, but हर कोई हॉस्पिटल नहीं पहुंच सकता है, no? So then this is the part where then building something in the community is very important. Can you have primary mental health care in communities so that only, you know, for example, very significant or very serious cases, only people who have that kind of need to go to maybe hospital. Can everybody else be taken care of in the community? So, you know, India's cultural attitude is we are a collectivistic society. So then this is about taking care of our own people within our communities. So these are some of the barriers. Some of it is infrastructure, some of it is manpower. A lot of it is about attitude. A lot of it is about planning together. Yeah, but it's possible. It's not impossible, but needs work.
So one key point you brought to the audience is the less budget allocation for mental health care, but that should have been increased even during this pandemic, as PTSD and trauma cases are increasing a lot.
It would be very helpful. Yes.
Yeah. Also, the lack of manpower.
Yes.
Yes. Government should at least focus on these two things: increasing the budget and increasing the manpower in the mental health care.
My suggestion also in terms of, you know, increasing manpower and budget in relation to these two things is also collaborations with organizations who are working in the field. You know, connecting with community-based organizations, giving them, for example, you know, access to resources, connecting them with perhaps mental health organizations. So then this is how collaboration is going to work. Because, for example, if you go to a new place and you try to create a brand new mental health organization there, it'll take time. Yeah. Which in some places it's very necessary. Maybe that is the way to go. But on the other hand, there are perhaps organizations and groups that can help in sort of training, in training, in manpower, in skill development. So I feel it needs to be it does need to be a collaboration between government, civil society groups, mental health organizations, professionals, and communities. Like it needs to be, so all stakeholders need to be involved.
Yes, and the government's role for the betterment of public, for the public good, it should be more interfering. Okay, so as psychological reactions to a traumatic event that affect an entire society, that's what we call collective trauma. So collective trauma plays a role in shaping the experiences of the present. How do you think this be addressed at the policy-making level?
So, you know, the point I made about collaboration, right? Like collaboration between different stakeholders. Because it's not just, you know, it's not just a problem for community. It's a problem for all of us. Yeah. As in, because we are all part of the community, you know, the government, civil society organizations, NGOs, mental health professionals, we are all together. We are all together a community. And very often what happens is, if you're not looking at the widespread problem, if we turn it into just these individuals are suffering, if we don't look at the larger picture, then we are missing out on a lot. So there's a paper by ActionAid that talks about, when you don't address trauma, and if it continues for many years or for a long time, it becomes a cycle. So generations are impacted. So it's not just now. So even right now, I think we can see that in the result of the COVID-19 pandemic. It's not just one generation of us that is impacted. Actually, many of us, many generations in our current society are impacted by what is happening. This is if you're not going to look into the problem, then it'll become a cycle. There will be increased stress in families. There will be declining socioeconomic conditions. There will be a burden on the healthcare system, right? We've already seen that impact, that the healthcare system is not able to answer the needs of the people. Breakdown of support systems. And if there's a breakdown of support systems and families, then that means children are not being taken care of. Adolescents are not getting the care that they need. Very often families are then impacted. Also, for example, isolation, right? Social isolation has had such an impact on all of us. And the economic productivity, most of us tend to focus on economic productivity as a sign of success in a society. But if all of these factors are also not being addressed, then economic productivity alone will not solve the problem. Yeah. It becomes like I said, it perpetuates a cycle. It's a continuing cycle. If we don't stop it, if we don't do work to stop it right in the middle, it'll just keep rolling. And that means it'll take more generations to address the issue. And this is why I'm saying that it involves all stakeholders. There's the idea that trauma is a public health problem. Okay, because like I said, right, it affects all of us. It's not just one group of people or one individual. It's not like that. All of us are impacted by it. An individual is one part of society. There's the individual, the family, the community, society. So when it's all of us in that position, I think it's very important for policymakers to see it as, this is not just about just groups of individuals. This is about how all of society can be impacted by trauma. So, for example, even things that seem like they're not related, so if you're looking at whether you're eradicating poverty, if you're looking at improving education levels in your area, if you're looking at decreasing social inequality, these things may seem unrelated, but the fact is these three examples are all related to some experience of trauma. So addressing these things will also have positive outcomes for health, for mental health, for human rights. So, the thing is, policymakers, I'm inviting policymakers to take a broad view, not to say that, okay, we are only going to work with some individuals who've been impacted by trauma. I'm inviting policymakers to actually take a broad view and say, these individuals are part of our society. And if there are people who are impacted by this, it impacts society as well. So we need to look at it in that fashion. So that's the invitation I have for policymakers.
I hope this message reached out to the policymakers. So COVID-19 brought to us a new thing, mostly new work from home. So this is a new culture in working. So work culture is gradually adapting to the previous practices of working in a physical space. However, after 2 years of working from home with limited in-person interactions, things are not going to look the same as they used to be earlier. So what do you think should be kept in mind by policymakers and the employers when they invite their employees back to the offices?
So I think the pandemic has actually allowed us to see what kind of work is possible in what kinds of ways, what kind of accommodations are possible. I honestly, which this might seem very unusual to say, but I do feel that the hiring pool has now been proven to be much larger than we assumed it was earlier. And when I say that, what I mean is many people with disabilities, right, can actually work from home. Many people for whom traveling to work is very prohibitive, like it's very financially costly for them to commute to work. Giving people like that an opportunity to work from home makes it easier for them to be part of the workforce. The point about, that there is a much larger workforce available to us than we've thought of before is something that has come out of the pandemic. And I feel that that is something that employers need to consider very seriously. Who are we including in our work practices? Who are we thinking about when we hire? If the right to work is a human right, yeah. So who are we allowing to exercise that right, and who are we keeping from doing that? One part is this, right? I think one thing that many employers that I'm still seeing in my work is that many employers may not be able to sort of keep in mind that if you're working from home, there are certain obligations at home that all of us are suspect to. So if you're not able to kind of pitch in, and then you're also asked to do more, when I say do more, I mean burning out. Yeah. If you're pushing employees to burn out, then we're basically putting them in a very precarious position, which actually has a long-term impact for the organization. Because if people are burning out, you're losing employees. Once you're losing employees, you have to retrain a new person. Like if somebody quits because they're burnt out, you now have to spend time onboarding and retraining a brand new person to do the same things that was happening. On the other hand, if you're being more mindful of this is what is needed to be done, this is what can be done over so much time, then there's no need to push, right? But the more we kind of focus on productivity rather than job satisfaction, the more we focus on those things, I think the more harm you're actually doing to our, to workers and employees. Flexible working hours it's already been proven, right? The pandemic has demonstrated that flexible working hours actually makes it more productive. There are many countries who are moving now to like a 4-day work week, because it's understood that, this is actually more productive for the organization than to force people into a 6-day work week and tire people out. So, I mean, some of these are, they sound very, perhaps they sound very, not new, but very impossible. But the thing is, unless we try and test these things, we're not going to know. Very often, the other part about the lessons from the pandemic for many employers is that, we've lost a lot of the workforce, especially women, because we've ended up creating very unhelpful environments for them. So not only are they doing work from home, but they're also expected to run a household since they're at home, and this is also this is a societal issue as well, right? This is about also how much household management duties are split between adults in a household. So there are these kind of concerns also to think about. Like I said, if you're losing great workers to these kind of issues, then it's a loss. I think it's a loss for society and the organization at large, because you're losing people who do good work because you're not giving them the space to breathe or to rest. And I think that those are also very important human rights along the right to work.
Exactly. There can be one more suggestion that if there's possibility of someone who can work from home without any complications for the office, he should go ahead till this pandemic is over.
I agree.
And you also talked about the nurses, female nurses. So it's recently been found by a research paper published by Royal College of Nursing in 2020 that 88% of the female nurses are worried about risks of family members during COVID-19 because of their clinical role. Absolutely. So before we move ahead, we have a very important question popping up on the Facebook page that What are the small tips that you offer to youth who are watching us today to take care of their mental health?
See, I'm not going to lie. Like, my problem with offering tips to youth is that youth are so different. Yeah. I think all of us, and I know this sounds like I'm sort of being vague, but the fact is that if the first thing I would say is to speak about it, you know. I think it is really important that we beat the stigma about mental health and encourage conversations for each other about our thoughts, about our feelings, because these are very, you know, normal. I mean, when I say normal, I mean that these should be normal things to talk about. Yeah. And I think my suggestion would be to encourage, you know, others who are interested in having these conversations. Having a safe space is very important. And maybe for youth who are interested in those kind of ideas, maybe they can help be the ones to create the safe space. You know, you may be able to come together as a group, as a collective in your communities, and hold space for each other and learn how to, you know, also rely on each other. Because the fact is that I don't think it's a good idea for youth to, it's not just youth, right? We're all social animals. We all thrive by our connections and our relationships. And relationships are a very important support system, are a very important part of our support system. So part of this then means knowing that there are others we can rely on. So I would say the first thing for many youth, which sounds, maybe you've already heard it before, but maybe take it with this idea that you are stronger in numbers. Yeah. So find, you know, build your own groups, have spaces where you can create the spaces. If you can't find them, create the spaces where you can come together to talk about the things that matter to you. And that's how you're going to find others who, you know, share the same views and who share the same problems perhaps, and maybe together there's a way to find a solution.
Exactly. So I have my colleague Akil Rashid who wants to ask a question. Akil, you there?
I'm here.
Hi.
Hi. So I think we have already discussed all of the important factors regarding trauma and PTSD, but still the basic question remains for me and for others watching us and who will watch us later. That is what are the symptoms of PTSD? I just want a quick answer so that we can add some more information to the little information that people have about the mental health, this mental health problem.
So I'm going to be very contrary here as well. You know, it's very tempting to reduce PTSD to just the symptoms. But, you know, like Jessica COVID, you know, and Zukam and all of these things have similar symptoms. The condition is always different, you know, and it does take somebody with that, the knowledge of the differences to be able to tell you what you're going through. So, for example, somebody can have anxiety, like 4 people can have anxiety and they can have anxiety for different reasons, no? So the focus on symptoms, I think, is very biomedical, because kya hota hai, then you're not paying attention to, it becomes like high or low hai. But the point is that there is distress. Can we focus on, you know, what is happening for the person? Like, what is it that's making them feel uncomfortable? Very often, I mean, if you Google PTSD, I think you will find any number of information about, you know, what kind of symptoms count as PTSD. But the most commonly ones are, you know, we talk about flashbacks, we talk about anxiety, we talk about mood issues, anger problems, very often physical sensations, right? There's like physical sensations like heart racing, sweatiness. A lot of people will report fainting, you know, when it's triggered. Sometimes they will have freeze responses. So this is what I'm saying. So PTSD is very different for different people, but I would say focus on the distress rather than the symptoms. Because symptoms se focus karna is very very narrow. Because it's only then you're focusing on the individual again. But you're not looking at, okay, you know, when this is happening with somebody in a space, in their families, in their communities, then what is the larger impact that's also happening is important. I don't know. I don't think that answers your question, Akhil. Yes, no, maybe.
Akhil.
Oh, I think we lost him. So.
Yeah, before we find him again, we have one more question.
Okay.
It's on the Facebook page. What has been the impact of lockdowns in increased cases of trauma and PTSD, mostly in COVID-19 patients? And what are your suggestions to tackle this down?
Like I said earlier, you know, very often what we're seeing with a lot of people is there is a lot of what we call, you know, like what we're calling community trauma at this point. You're seeing community trauma, you're seeing trauma with individuals. There's a lot of disconnected social relationships. A lot of people feel like their social networks have been damaged. There's, you know, what is considered a social norm is different now. So you're having to rethink what is acceptable, what is not. Even in terms of, even if you look at like opportunity wise, there is, you know, for example, intergenerational poverty, long-term unemployment, businesses that have had to relocate, yeah, jobs, people having to lose jobs because businesses are not able to stay open, employment that is very limited, like part-time or very short-term or like seasonal employment. Very often even just disinvestment that is happening. These are all actually, so this is not an individual level, this is all community level, yeah. But you can see, right, when these things are happening, that means individuals are not, that we're not able to find jobs, that we're not able to sustain our lives, that we're not able to create the futures we want to create, right? Communities are also then impacted. So all of these things, right, tie in together. It's not just, it's not just, okay, at the individual level, ye sab karna hai, but it's also like all of this connects, all of this is connected through the individual, through the family, through community, into like it is a whole social picture.
Yes, exactly. Also, the PTSD should be paid attention to by all the policymakers all over the world because of the substantial burden in population, regardless of different sex, gender, geographical coverage, and even income levels, etc. So public health strategy involving mental health response is warranted, especially in the area of post-pandemic and even after long-term recovery period. Yes, so we have one more question.
Okay.
Have there been any government policies to increase the number of healthcare ratio? I think the question asks about mental healthcare workers.
There's actually, so the thing is that there are a few new acts that are looking at regulating the field in the country, that are looking at sort of addressing, you know, even stigma. Like, for example, the Mental Health Act is very patient-centric, but the problem is also then it doesn't really, you know, for example, it doesn't have a section of psychotherapists in the law. Yeah. So you have psychologists, you have psychiatrists, you have psychiatric social worker, you have nursing, and that's kind of it. But for example, there are many communities that have had lay counselors, like ASHA workers, right? Programs that have been run as part of the National District Mental Health Program, which was started in 1982, right? Post which the National Mental Health Act was actually instituted, 1987. Before that, it used to be the British era 1912 Lunacy Act. So modern India's, or post-independence India's first mental health act is actually the 1987 Mental Health Act. So the thing is, the government has had plans and commissions to think about what mental health can look like in the country. But again, like I said, budget allocation is so little and there are so few manpower. So unfortunately, then moving it forward at a faster rate has been harder to do. The most recent version of the Mental Health Act, which came out last year as well, also includes, for example, the version that came out in 2017 and the new amendment and all that came out last year. There's already been the mention that insurance should cover mental health care. In my understanding, there's only one company that actually does it, but that is also psychiatric admissions, But what about therapy, for example? What about community care? None of these options have been explored. So all of this is also there are still ways to go about this. There are still a lot that policymakers can do. I think these are all good starts, but the problem is implementation is the issue. So, this aspect of where have we come from? I think we have a good understanding of that. But the question is, where do we want to go? That vision needs to be a lot more clearer, because that's what's going to help us actually move faster then. Like I said, India is a very large country, right? I don't know if it'll ever be possible for us to have 35,000 psychiatric nurses, for example. But if we want to get to that, what needs to happen now? This is a long-term goal. We're not going to have 35,000 nurses next year. We're not going to have 20,000 social workers next year. But if we want to get to that, where do we need to be now? Where do we need to start now? That's the starting point.
Thank you. And Akhil is back. Akhil.
Sorry, Akhil, I was saying, I don't know if you heard my answer, but I was saying that I don't think it satisfies your question.
So but I think I was supposed to ask the question I asked before that. I should have asked a very important question. That was that before we could know the symptoms of this PTSD, we are supposed to know that how should we approach a health professional, and how should we go for its diagnosis. So can you just tell us something about how to diagnose PTSD? What are the procedures?
So in terms of, generally speaking, I would say that, I think it is important for whoever is doing, the thing is, again, diagnosis is also a label, right? And some people are very afraid of stigma from labels. So in terms of what it means is to think about what is the purpose of the diagnosis? What will having the diagnosis help the person with? Is it about figuring out how to, work through the impact of the trauma? Is it about accessing mental health care or medical care? For example, maybe it's important to have a diagnosis. For example, insurance in other countries, insurance companies will not pay for your care unless you have a diagnosis. Okay. So some of these things are very important to think about why we are asking for a diagnosis, who needs a diagnosis. Is it acceptable to provide care? If somebody says that they're distressed, is that enough to provide care? Again, like I said, the association of trauma with many conditions, behavioral health conditions, chronic physical conditions, substance use, mental health issues, risky behaviors, all of these things are kind of attached to each other. If we are not thinking about, again, if we don't know why the person wants a diagnosis, then, we may be doing them a disservice by only focusing on symptoms. Like I said, no, it's not just the individual. Sometimes it's what's happening in the environment also with the individual. So, for example, somebody who's experienced COVID-19 through the pandemic, all we can do what we can do for them is perhaps provide mental health care, but the larger environment has not changed. So we're more likely to just see the continuing problem. But in terms of how we see a diagnosis, right, for PTSD, give me a second, I'm thinking about it, because I'm sort of just like, maybe it is useful from an awareness perspective, right?
Yeah, please.
So it's thinking about, what are the characteristics, right? Or even in terms of what are we calling PTSD? So very often, again, as Tanveer had also talked about, PTSD is often the post-traumatic, what is called post-traumatic stress disorder, is essentially the events post an event of traumatic significance for a person. There is a response to the event that you see in individuals that is very often triggered by the previous event, right? So the condition, what happens is that most often it can be delayed or it can be immediate. You can see it immediately sometimes in people, sometimes it shows up later. But the symptoms can include, anxiety, it can include flashbacks. Some people will talk about nightmares. Also, some people will continue to think deeply about the event. Like they can't stop, but they can't help but keep thinking about the event, which is also called rumination. Very often, post a traumatic event, it's very difficult to adjust to normal life again. Because like I said, if you're always thinking about this event and if you're suffering from flashbacks and you're reliving the experience in your mind, then what is happening? It's very hard to adjust to currently what's going on. It's very hard to pay attention. It's very hard to be present. So it can affect your day-to-day functioning. So it can affect different domains of your life. Very often the point is that the thoughts are distressing. Yeah. If you're having nightmares, they're very upsetting. They may be tied to the traumatic event. The flashback is that when you're conscious, sometimes a noise or a sensory stimulus that is similar to the event you experienced can have the effect of, it can have the power to, if you hear something similar. So for example, many people who have experienced gunfire, the noise of gunfire. So many people have experienced the noise of gunfire, suddenly slamming doors, right? Any sound that sounds similar to that can sometimes cause people to experience flashbacks if they have PTSD. Yeah. Very often there's a lot of emotional distress. There's also physical reactions. Like I said, many people do develop physical symptoms as well. Often there is also a lot of hopelessness. There's a lot of negative feeling about after the event, because you feel like, nothing's going to change maybe, or you feel like there is no hope for the future. Sometimes you'll feel like there is no, there's no point in being attached to others. Like there's no point in looking after your relationships. So many people withdraw from others. And very often there's a lot of emotional numbness also that is seen. So these are some of the most common symptoms. Yeah. But you can also see specialized reactions in some people, depending on what the experience is. Yeah. Does that help, Akhil? You're on mute. Sorry.
Yeah. Sorry. So yeah, it really helped. It really helped because
Okay.
the symptoms you discussed, those symptoms may be very painful, but yet here we are discussing them. Those are very important for people to know, like what is it like to go through PTSD and experience mental health problem. So before I present the vote of thanks, I would like Tanvi to I would like to know from Tanvir if he has some more questions, like, so he can, if he has any last questions for you, Tanvir. Hello?
I think
Tanveer, are you there?
he's connecting to audio.
Yeah, sorry, mobile internet is a big problem here in Kashmir. Yeah.
No, absolutely. Networks can be difficult.
So until Tanveer joins us. So I totally understand it that it's not very easy to answer questions on mental health. It's unlike other diseases that we have in medical sciences, the common diseases. So, but mental health is something which is very. I think the answer should have those answers have to be very expressive and very empathetic. So I think Tanveer is not joining us. He's just trying to reconnect.
He's trying to reconnect.
Yeah. So Tanveer.
I was going to say, like, I think the simplest way to describe PTSD or trauma, or like what are common characteristics, rather than symptoms, is like three things. One is you're feeling scared, or you're fearing something scary will happen. Feeling like you don't have control over what is happening. Yeah. And then the last thing would be whatever is happening, you feel you don't have the ability to cope, as in it is more than your ability to cope. So when you look at these three things, very often these three characteristics itself are signs of the person has experienced trauma, if this is what they're experiencing. But I think we've also, unfortunately, I think Akhil has also fallen off the chat. The conversation. We're going to wait and see what can be done. I think we are coming to the close of the event, though, but I'd like to thank everybody for giving us questions and giving me questions to answer as well. So,
ma'am, thank you for being with us. I guess there is some network issue.
Yes.
Yes. So it was great to hear the thoughts on the mental trauma. So we thank you for your presence here, for giving us the time.
Thank you for inviting me. It was a pleasure.
Yes. Maybe Akhil is joining back and Tanveer is okay. This is the problem here with like the internet and mobile networks.
Absolutely. No, even where I am, there is, like, when it rains very hard, like if it rains, the network is very shaky. So I understand. Difficult.
Thank you for your understanding. In places like this.
Yeah. Part of it's also something to do with infrastructure, no?
Yes, absolutely.
Necessary to look at those things.
So I guess we should close this live thing.
Well, Akhil is here. Maybe we can see how it goes.